Hi everyone, and welcome to today's webinar, Stopping Calf Scours in its Track. We've got a great lineup of speakers with us today. So you're going to be finding out, understanding the main causes of scours, the importance of testing and knowing what pathogens are actually involved in causing the issues. And then we're going to go in looking at practical prevention and treatment strategies that really work on farm. So our speakers today, just to introduce them, we've got Dr. Kat Baxter-Smith, veterinary advisor at MSD Animal Health, who's going to give us an overview of the scour causes. Then we've got Kat Hart, who's a vet surgeon and young stock specialist at the George Vet Group, who's going to cover on-farm management, prevention strategies and treatment protocols. And then we've got Rob Drysdale, who's a farmer and vet, who's going to share practical insights and real-life examples of where scour has been an issue and treatment strategies that have worked. Each of our speakers are going to present for about 10 minutes with a PowerPoint presentation, and then we're going to open up with questions at the end. We have had quite a lot of questions already sent in, which is absolutely fantastic. So we're going to address some of them first. But if you have got a question as we're going along, please drop that into the chat function at the bottom of your screen, and then hopefully we'll get to that at the end of the presentation. So yeah, without further ado, let's move on to our first speaker, who's Dr. Kat Baxter-Smith from MSD Animal Health.
Hi there, hopefully you can hear me okay. And let me just move the slides along. So I'm going to speak briefly about the causes of calf scour. So hopefully you can see my first slide because I've got two screens. So I just wanted to check you can. It should be the one with the calf face on it. Yeah. It's just a slight delay in my on my second screen, I think. So yeah, stopping calf scour in its tracks and the causes of scour. So scour is one of the main causes of calf mortality on farm. The other really being pneumonia. And we have done some work, as in MSD Animal Health, have done some work where we sent surveys out to sort of large numbers of farmers to ask them about the issue of scour on their farms. And through these surveys, we found that in the pre-weaning period, around 48% of calves have been reported to have scour. So it is actually really common. And I'm sure plenty of farmers that are watching this will appreciate that. And generally, it does occur under 4 weeks of age. So it's often in these young calves. And this is really because their immune system is not fully developed yet. They're facing a lot of challenges when they're first born and in the first few weeks of life. If they've maybe not had enough colostrum or not had colostrum quickly enough, that can predispose them to scour. And other diseases like pneumonia can also make them more likely to get it. So it's really that first few weeks of age. Also, we were talking about this just before the webinar started with the other speakers, but it's really affects farmers in terms of how they feel about the calves and how they feel about calving time. So in our work, we found that it can make young stock managers actually dread calving time. It can be very depressing to see sick calves and to be losing calves. And that's, not something that we should brush over. It's not fun to be treating animals. We want to be seeing them healthy and well. So in terms of the causes, I'll briefly go through those. They are always the same, so it doesn't really vary from farm to farm. We can see that around 80% of cattle farms have experienced scour on their units, and 50% experience calf mortality due to scour. So it is very common, and so this pie chart on the left shows the common sort of pathogenic causes. Cryptosporidiosis is the one in yellow in 33%. So cryptosporidiosis is the #1 cause, and that's the one we hear about the most, really. Rotavirus is also very common and found on many farms. Coccidiosis tends to cause disease in slightly older animals, as you can see in this graph on the right. So they tend not to get that until they're a bit older. So if you're seeing scour in very young calves, you're really wanting to look at crypto, E. coli, sort of rotavirus and coronavirus. We also have small amounts. E. coli is less common, but is very severe. So if you have very young calves of a few days of age dying, it tends to be due to E. coli, but it is less common. And salmonella can strike from any age. Salmonella also is, it doesn't just cause scour, it can cause lots of different symptoms. So, and also can affect older animals. So I'd say if you've done some testing and you don't seem to know what's going on and you're getting unusual symptoms, it is worth looking at whether salmonella could be an issue as well. In terms of just finding out what's going on, I think before you start a prevention plan, it's important to know what's happening on your own farm. And it's worth doing this on a regular basis. You will find often these pathogens on most farms. Sometimes they won't be associated with scour. So really you want to make sure you're testing calves that are scouring. So you can use test kits such as the scour check kit, which can be used on farm, so can be used calf side, and in conjunction with your sort of veterinary advisor to understand the results of those. And they can be done on calves. I would use ones which are just in the early stages of scour and ideally haven't been treated with antibiotics, because then you'll get a more accurate result. So these will test for rotavirus, coronavirus, E. coli and cryptosporidium, which, as we know, is the most common causes. If you want to look for other pathogens such as salmonella or coccidiosis, you'll need to send them to the lab. But this is a good first line test, I would say. In terms of how it's transmitted on farm, it's fecal oral. So basically, if an animal with cryptosporidiosis, say, is scouring, another calf comes along and contacts that feces, it will get infected very easily. There's a sort of fact whereby you only need something along the lines of 20 oocysts of crypto, which is a very small number, to infect another calf. And if a calf is scouring, it's producing thousands of oocysts of crypto. And they are everywhere, and that's what makes it so difficult. And they're very hard to get rid of. So, you do need to be very rigorous with hygiene. And so you can see here other calves from their own dam, from the environment, from humans and other animals, and from the drinking water. So it is. It would be basically almost impossible to stop it from coming in altogether. So we really have to then prioritise the cleanliness, reducing the pathogen load, and also increasing the calves' resistance to it. So on the next slide, we'll have showing the impact of calf scour. So we've got a picture of the intestinal villi, which are in a normal calf long, so it's a microscopic picture, but in a normal calf these are long and can absorb. It means that the gut is able to absorb a lot of nutrients and water, and it means the calf can grow normally and take on the essential nutrients that it needs. Whereas when they get scour, these villi are stunted because the pathogens will attack the cells of these villi and cause them to become stunted and smaller. And as you can see from the pictures, the stunted villi are probably less than a quarter of the size of the ones in a normal calf's intestine. So this just means they cannot absorb all the nutrients and water they need to grow. And this is why we particularly see effect on growth rates. This does seem to be the #1 issue with cryptosporidiosis in particular. You will notice that growth rates are affected. Some farmers ask me if, like, oh, okay, they've had scour as a calf, but does that not mean they'll be okay? They'll catch up later. Actually, they don't necessarily. So there has been some work looking at growth rates from more done, and the calves that had scour due to crypto didn't catch up to the healthy animals, so they always did way less. And also you'll be having to feed those calves more to get the same benefit. So calf mortality is obviously an issue, and they will die of it. But also we have the morbidity, as in the disease that has been caused. So the fact that these animals may then not go into the breeding herd, and you may have invested in genetics in those animals. So yeah, we get the lower growth rates, delayed time to finishing, fewer calves in their own lifetime, higher replacement rate and associated costs, increased disease susceptibility, additional treatment costs, so your medication, labour and time, and many farmers don't tend to put a cost on that, but it is an important thing to think about. And then the fact they're more likely to come down with other diseases as well. So we are going to speak to, after myself, two other vets who have some really good practical experience for dealing with scour. So I think that will be really good. And in terms of an action plan from my end, if you have issues with scour on your farm, there's really three key pillars for the plan. So the main thing is maximising the resistance of your calves, because we know that the bugs will always be there. So if the calf has got a good immune system, it's more likely to be able to fight those off. So following the 5 Qs of colostrum management, we are going to go into those in another farmer webinar that we have Friday next week. So I'm sure you have heard a lot about colostrum, but colostrum is always key. Monitoring failure of passive transfer. So this is where we're taking blood samples from calves under a week of age to see if the colostrum is actually being passed to them properly, and then cleanliness as well. So we're maximising our calf's actual immune system. Pathogen identification, so we know what's going to be there, we know what we're dealing with, and then you can develop a plan with your vet. And then actually managing the calves themselves. So if you have scouring calves, identifying them really early is key, isolating them away from the others because they will be infectious, rehydrating them. Rehydration is really the most important treatment for scours, certainly more important than antibiotic treatment. So getting them rehydrated, everything is being cleaned, putting them in a nice environment where they can be warm and they can heal, and aiding their recovery in that sense. So a few slides from me here. I'm going to pass over. So any questions, please do put them in the chat, and I will come to them at the end. And then I think I'm going to pass over to Kat Hart, who is from the George Vet Group and a veterinary advisor.
Hello there. Hopefully everyone can hear me and see my slides. Thank you, Kat, there for a great introduction into the causes of different scours. I'm going to try and take a more sort of holistic view now and do a bit more on housing and hygiene, really. But definitely to back all that Kat said about making that resilient calf. Anyone that knows me, I could speak for hours on the colostrum or the nutrition of these calves, getting that first day from a colostrum point of view, or that first week, that balance of getting enough nutrition into these calves while still balancing sometimes that scour challenge in that first week can be a challenge. But for today, I'm going to focus on the housing and hygiene point of view. So let's make a start. So yeah, I've been at the George now for nearly 15 years and really passionate about young stock care. So I was from a dairy farming background at home, and really when I started going into the vet world and seeing particularly a lot of dairy work, the difference between some of these really high production cows compared to what the calves were seeing in the calf shed was quite eye-opening. So I thought I'd really focus on that, and it's been a really rewarding part of my career so far, and took me to lots of exciting places and spoken to lots of farmers. So hopefully we're going to have a few more practical hints and tips, but also trying to keep it broad around all the causes of scour today. So the aims of what I'm going to talk about is, again, a lot about the hygiene. So always remembering we've got to start at that calving pen where the calf first hits the ground, but focusing a lot within the calf housing itself. So particularly in that milk calf group, which is where we're going to spend a bit of time to focus there. But also just not to forget those water troughs and feeders. That's a really important one that I think often gets missed from a crypto and cocci disinfection point there particularly. Then we're going to spend a bit of time on the housing side of things. So bedding amounts, straw is, I'm here in the southwest, but even here, straw is extremely expensive this year and very low in volume. So it's still important, but maybe consider some other hints and tips this year, going through a bit of the ventilation And then also how we group calves, particularly on that dairy farm, that first sort of 3 weeks of age, how we can group calves can make a massive difference. So we'll spend a bit of time on that one. And then just some general sort of treatment approaches. So when we can use fluids, what about non-steroidals, and maybe a bit of a discussion on the antimicrobials, which I'm sure will follow into other people's presentations, and hopefully we can get some questions on that as well. So let's dive a bit deeper into the hygiene. So really, to get around this scour problem, we really need to be doing all in, all out grouping. So within the milk phase of calves, on a, say, dairy where they're being born, we need to be thinking we're going to open this pen, fill that pen for, say, 2 weeks and shut that door, keep those calves in that place, and then start the next pen. So with a calving all year round system, this really can be a challenge, and it can be quite a mindset shift compared to maybe places where the young calves are always in this pen and they get moved along a shed. But if we can move to an all in, all out system where they enter a pen and then they stay there until they're weaned, it will make our aims of trying to control these bugs a bit more easy from a hygiene point of view. And hopefully then these calves have been in this pen. They might have been attacked by an outbreak of scour or not, but they've all got through it. They're all weaned. Now what do we do? And it's this, how we clean out and rest these pens is really important. So we want to remove as much organic material as possible. So that is often by using machinery, and on some really large units, they might have a separate telehandler for the young stock, but often this is from the cows. So making sure we are knowing our risks from our cows. If we are going to wash or disinfect machinery before it comes into the calf shed is another topic to maybe think about. Scoop out all the manure that we can get, but then we still have quite a lot of organic material on those walls, haven't we? So really then we need to go in with a steam cleaner to get all that off the walls and off the floors. The risk is, particularly in an all year round system, is actually we can then aerosolize all those bugs and it will land in the pens next door. So maybe consider how we can do that, or which days we can pick to do that, and maybe seal the floors so it can't leak under gates into the next door pen. So hopefully we've now got a clean pen, and then we're going to disinfect. And there are lots of disinfectants available. We really want to be targeting those crypto and cocci ones, but making sure we're putting them on the correct dilution rate with the correct contact time, and also with the correct PPE for the people putting it on. So depending on the product, some of them are nastier than others, basically. So some need more protection for the people applying them. And also just to put in here is do check your milk contracts, because some of them are tighter than others with which products you can use. So hopefully then we've got this nice clean pen, and this is our sort of day-to-day management. So we can just keep those levels of cocci and crypto and oocysts at a general level where we can put in resilient calves, as Kat mentioned, really good colostrum management, really good nutrition. We get resilient calves and they can deal with that level of challenge. We will always have challenge, particularly from the crypto point of view, but we need to make sure these calves can deal with it. So that's sort of from a batch to batch point of view. I thought it might be a useful thing to put some ideas about how other people can manage it. So some people want to do a once a year deep clean, which obviously for our block calvers is very easy. Those sheds are empty for maybe 9 months of the year, 6 months a year, definitely. So they get a great chance to dry and get some UV penetration. But even for our all year round calvers, you might be able to pick maybe 2-3 weeks in the summer when calving levels are maybe a bit lower. And you might actually think, well, we're going to move all the calves out of that shed for 2 weeks and really have a deep clean. You might want to repaint the walls. There are lots of new sort of rubberized plastic paints that make that wall cleaning a bit easier. So that could be your chance to really get in and give that a deep clean. Again, just to really hit those levels of crypto and cocci back down to a level where the calves can deal with it. Another system is trying to rest pens between groups. So once you've weaned and done your clean and hopefully done your pressure washing, your steam cleaning, applied your disinfectant, if we can wait up to sort of 2 weeks, really, that is one of our best and cheapest ways to manage these bugs. Yes, it does mean we need extra pens, but this is definitely value for money. So anyone thinking about putting up new sheds, or if they're thinking of going up in cow numbers, really remember that this drying and resting time is extremely valuable. As I said, we need to consider what's going to happen if it leaks under those walls or we spray it over the top. So how are we dividing up pens? Are they solid sides? Have we, stuck them to the floor so we're not getting leakage from one pen to the other? Because often in our systems, the pen next to the newborn calves is actually the eldest calves. So we really need to try and make sure that there's a gap there. Ideally, a spare pen, which is being rested and dried. But if there is directly older calves one side of a wall or a gate and young calves the other side, we know that that's going to be a challenge. And again, just not to forget those water feeders there as well. So those need to be emptied and cleaned and disinfected the same. Okay, so a bit wider then onto housing. Where do we start with this? So maybe thinking about just the stocking density of the pen. So how many animals can you fit in that space? So really here we're looking for a target of 3 meters squared per calf as a total space, or 2.5 meters squared for a bedded space. They're sort of some of the aims we get to. And definitely when we're getting down to nearer 2, we will see challenges and we will need a lot more preventative measures in place on those farms. So space is really one of our helpers. If we can give calves more space, they will reward us. Also, as I hinted at the beginning, this idea of age range, particularly if you're putting calves into groups on maybe day 1, day 2, making sure that there aren't those older calves which are just excreting these bugs and infecting the newborns can really make a difference. So often with the bugs we're discussing, if you go back to, one of Kat's original slides, seeing where all those bugs hit in from an age point of view, around 7 to 10 days, a lot of these calves are excreting a lot of bugs. So whether they are clinically sick and we're having to treat them, or whether hopefully they're resilient enough in dealing with these bugs, but they'll be still excreting a lot. So if we're mixing newborn calves in with 2-week-old calves or older, we're going to hit a challenge really. So how we can try and have often a bit of a mental shift to say, instead of, oh, this pen always has 10 calves in, we might think about, okay, we're going to open this pen and fill it for 2 weeks and shut it, whether they have maybe 7 calves because we've been a bit slower on calving, or maybe up to 12 calves because we've had a lot. So sometimes, yes, we need to make sure our stocking density isn't excessive, but moving to a days per pen rather than a numbers per pen might be a different way to think about it. But again, speak to your vets and see what they think, because they know your farm best. So that does bring us on to group size, the range of the stocking density and the age. So the smaller the group, the better from a disease spread point of view. But obviously, with more milk machine feeders being used, we have to make those affordable and efficient. So group size is important, and how we get to those between our stocking density and age range is an important factor. On top of that, we have got ventilation. So this is really going to help by keeping that bedding dry, but also limiting the effect of follow-on pneumonia. So it's really common you get an outbreak of scour, run through a shed, and then maybe 2 weeks later, pneumonia will follow. So we really need to be getting that ventilation right. And again, the nesting score. So as I hinted at, straw is a challenge this year, but making sure that we are putting those layers of straw between the calves and the feces shed out will help. But also it will help that calf be more resilient as we head into winter and they just need a bit more thermal buoyancy. So finally, then, from me, is trying to take a bit of a holistic view on what we do from a treatments point of view. So I think all causes of scour, luckily, the treatment for that individual calf is very similar. So they require these extra fluids, electrolytes, and within the electrolytes, it's really important to make sure that they've got some buffers in there. So a lot of the Scour will cause an acidosis. That's where you can sometimes see in calves where they've lost some of the hair around their bum, sometimes around their muzzle as well, and patchy. So we really want to be making sure that they get the fluids in and they get those electrolytes. We still really want to keep them on milk to maintain and heal that gut lining. It's really important for the proteins within the milk to keep that gut lining and all that microbiome keeping within the gut, but keeping those meals separate, the electrolytes are important. So that's a mainstay across all causes of scour. This is something we've really got to get these fluids into these calves. Non-steroidals is another really helpful one. Obviously, with these guts, as Kat showed with the microscope slides, they're very inflamed. Sometimes you can see calves even straining and sometimes blood coming through the feces. So we can see a lot of the pain signs in these calves. One of the challenges is we've got to make sure that they are hydrated and to prevent any risk of kidney damage. So yes, non-steroidals do have a place for treating scour, but for me, we really need to be getting the electrolytes working well and the fluids in as well. And then what about this elephant in the room, the antibiotics? Are they needed? Well, as we've hinted at, most of these cases are viral and parasitic. So we're thinking about that week to 3 weeks age group here. But there may be some differentials that we might want to use antibiotics still. Definitely speak to your vet, but some of them might be, for example, if they are very young or older, because we think actually there might be other things going on, say salmonella, if any specific bugs have been diagnosed on your farm, then we might want to do things differently. But generally, some of the mainstays would be if blood is present within the feces, we might want to put antibiotics in then to prevent some sepsis, or if we're seeing any other mental signs. So, for example, we're worried about sort of meningitis type signs. So that can often come alongside with scour. So definitely then antibiotics are required. But again, speak to your vets and see what they think. But this is sort of my general approach to scour. So hopefully that was a bit of a whiz tour through some of the housing, grouping and hygiene things and just my view on treatments. So I think we're going to have questions right at the end. So I'm going to hand over now. I'll click on to the next slide. On to you, Rob.
Hi, good morning, everybody. It's interesting to be here listening to different people's approaches to calf scour, because it's so really become a problem now for a lot of our farms, and a lot of the farmers that I work with would still see some form of scouring on a regular basis. And as Kat said earlier, 48% of respondents said they were seeing calf scour issues, and we definitely see some farms have it more than others, and as a farm vet, we kind of have to try and keep the same approach every time. And I'm going to try and give you sort of a breakdown there. And also because I've reared calves myself, and I've been very lucky to work with some big calf rearing businesses, probably talk a little bit about dairy beef and the sides of that as well, briefly. The most important part about all this is no two farms are the same. So if we try and create a cookie cutter approach to calf scour, it tends to fall over at some point. This summer, for example, we've seen the very dry weather. We've seen cows nutritionally stressed. We've seen heat in the cows. We've got issues probably with colostrum quality starting to come through now. Placental insufficiency. There's a lot of work that says calves born after a heat wave tend to have bigger problems. And actually their calves themselves after that can even have problems as well. So there's so much more that goes on inside the cow that we don't understand. And calf scour sometimes actually is just really a symptom of a bigger problem. And as a farm vet, that's something we quite often have to look at as well, because a calf with scour on a farm may not be too much of an issue if it's a problem just for that one calf. But if we're starting to see a trend or there's a bigger issue there, quite often, as Kat was pointing out, there are other things there at play that quite often require a different approach and maybe a change in things. So just to sort of give you my thinking, the classic one, first of all, is feeding, and management. Is feeding too much milk a problem? And there's a lot of calf scours we see where we'll be told, oh, it's a nutritional scour, and that's potentially true. There can be issues there, and there's a lot of work now on transitional milk and the approach we see with some farms moving towards even feeding whole milk versus milk replacer. And there are some benefits to taking an approach with a protocol to that early life stage versus later on. If we're seeing calf scar very early as well, are we seeing issues? Really, it's down to management, and that the classic would be overfeeding of solids. We sometimes see happening, or calves being fed too quickly a lot of milk that's at the wrong temperature or the wrong mix, and we can see problems there. We can see problems with consistency, I would say. So temperature feeding of the milk, if it's too hot, the cows don't want to drink it. If it's hot some days and cold other days, you'll get differences in their response as to how they even ingest it, how they eat it, and where it goes to within their guts. And so that's something I quite often see issues with. So I always say that if you feed the calves consistently, they'll do much better. If you're consistently rubbish at it, then the calves will actually be okay. It's when somebody's very good for 14 days in a row, and then somebody takes over for a weekend, and then all of a sudden we have scours 3 or 4 days back after the initial person comes back from their weekend's holiday, that we see issues. And of course, trying to get to the bottom of what's happening there on that mixing can sometimes take a little bit of a forensic detectives approach, especially on farms where nobody really wants to hold their hand up to, well, I just use a jug, I'm not quite sure how much I use, or what do you mean it's supposed to be at that temperature? And no one ever told me that before, is a classic we see as well. So, before we go and start looking at disease, sometimes we have to stand back and look at the other sides of it. And as we've heard earlier, even colostrum has so much of an effect in that first few days, but even prolonged afterwards with the antibodies in the colostrum and other things that are existing there. Feeding good levels of colostrum can make big differences in the longer term as well to the calf's microbiome, to its gut, and its ability to cope with other things being thrown at it, like E. coli and salmonella, and even crypto to a degree. So before we really start looking at calf scar as a vet, I always try and get to the bottom of, is this an issue that's infective, or is this an issue of effectiveness, as in mixing of the milk and managing and nutrition, grouping, for example, as well, and taking the animals through. Cleansing and disinfection would be a good one as well that Kat touched upon. So if it is an infection, if there is an infection there, and we're thinking there is an infection there, and what really is the problem, and obviously earlier on you heard about the differences we kind of look at. For me, it's quite simple. The timing of the disease when it first starts to show is quite a big help and hint as to what probably is going on there. Looking there, the way I've said it is, I always teach the young vets that I work with that if it's less than 5 days old, it's virtually always going to be bacterial of origin, or some form of transitional issue or something else. If it's between 5 and 7 days, you're starting to see the likes of crypto creeping in, and then rotavirus, and obviously rotavirus and crypto, and then finally, as we heard, coccidiosis. And actually, some of these diseases we see, they're actually really parasitic infestations more than anything else. And crypto, for example, is a really good one, because it is just basically a disease of, how much animal shit has the animal taken up the calf, because it's all about, actually, just like children, they have to be exposed to some of these pathogens, some of these parasites to get resistance. So it is a completely normal thing, I find, to find a small level of rotavirus or a small level of crypto when we're sampling, because those calves might be completely normal in themselves. And I've even seen farmers being convinced to use treatment regimes when they haven't actually really got an issue in the background there at all. So the time of the disease is a big one to help us, and how the calf is behaving. And really looking at it as to, has this started very soon after birth, or has this taken a few days, a few weeks to develop? Because those differences can make a difference as well as to how we approach therapy. And number one always is rehydration. So if we were to look at tests and what are we looking at, I always think to myself, is how many are affected? Is it 1 out of a batch of 20? Is it 15 out of a batch of 20? Is there different degrees, different symptoms, different levels of problem? Have any died? Because quite often it's quite helpful to be able to do a post-mortem if you get one that's died very quickly, but actually also if the treatment regime that you're undertaking on the farm with rehydration therapy especially is working, we may not be seeing mortality, but you may not realize how bad it really is in the background. And as we heard earlier, that can end up with stunted calves and prolonged damage and even lack of milk production or beef much later to finish for beef cattle. How many are affected, but then what's the diarrhea, the scour look like, but also how are the calves behaving? So are they showing symptoms of colic, looking at their sides, kicking their sides, laying there, throwing themselves around with gut pain? Is there bloating? So sometimes we see issues, actually, we have to not rule out things like clostridial disease. There's one nasty clostridia that can cause abomascitis that can sometimes follow on with feeding regime issues. So if we're seeing problems with mixing, I'll quite often start to worry that we're going to start to see abomasal bloat, this Sordelii issue you sometimes see. Tooth grinding is a good example as well. So calves that have a sort of subclinical crypto or cocci quite often look a little bit tucked up, a little bit sore in their guts. I'm sure you all have seen it yourselves. They're maybe not got a scour as such, but they're maybe not just quite as full of appetite. They're not wanting to get up around as much, and they may be, grinding their teeth a little bit and feeling a little bit sore. And that's a good sign to me that in the background there's a subclinical issue brewing as well. And when did it start? Are we on calf number 3 in an outbreak, or are we on calf number 23 in a disaster as well? So we don't want to get too excited sometimes about problems, but classic would be a salmonella, where we might see a bit of blood, a bit of funny feces, a bit of coughing, maybe a bit of meningitis, other things that we heard about earlier that sit alongside a calf scar. And so as vets, you sometimes see us probably look like we're overreacting a little bit, because if some of these symptoms are starting to throw themselves as salmonella, we probably change our approach a little bit quicker. And then, are they responding to treatment? Are they responding just to fluids? Because if fluids and non-steroidals are doing the job, then in reality, it could well be something that the calves are just getting a little bit too much of, and they're getting over it on themselves, especially if you're vaccinating the cows as well. Quite often the calves are showing better responses there. We've already heard earlier about the antibiotics. Do we need antibiotics? I'm a great believer. We only use antibiotics if we can see blood or severely sick calves that are showing signs of meningitis or real high temperatures, where you're suspecting in the background there's going to be a salmonella or something else as well. We tend not to use antibiotics if the calves are over a few days old, because again, unless there's a real problem, it's more likely to be viral or protozoal, so more likely to be a parasite and a virus, which, as we know, the antibiotics aren't going to touch very much, although the old favourite trimethoprim sulfonamide will actually help you with a coccidiosis outbreak if you really do come to it. Fluids are probably the most important one, keeping them on top of fluids. For me, diagnostics are really the most helpful, and we used to use the total proteins sampling with the bricks. Now we're using immunoglobulin testing and pinpricks on the nose, and we've got quite a lot of farms now. We routinely are doing that with the farms themselves, and finding it's really helpful to monitor colostrum management, and it's quite often useful, and you'll see that in a minute in an example of one of the farms that just had an outbreak of a problem on. And then obviously lab testing. We can use a scar check on farm. It's quick and simple. It's very good from the point of view of ruling in and ruling out certain things. We do have to take it with a bit of pinch of salt. Like I said, a single calf may show a slight rotavirus or a slight crypto response, but is that what the problem is? And vice versa. You can always take samples and send them off to the lab. But obviously, when you're looking down the barrel of a gun with an awful lot of problems, like I say, if it's early calves and you have to make a decision, you move forward with the vet on board. Postmortems are sort of like helpful, and certainly they can help you if you think you've got a salmonella outbreak, for example. Don't forget, and this is one that I think is important, we've not really mentioned very much here, quite a lot of these scours can be zoonotic. That means you can catch them yourself. So classic is salmonella. The old-fashioned, and we don't see it so much now, although people with vapes are starting to do much more of this again. Roll-up cigarettes and bacterial calf scours were always a fantastic one for seeing people go sick about a week later with a salmonella outbreak. So just don't forget, and even crypto. If you've not had crypto yet, It's one of the best ways to lose weight. I'm just waiting for my next outbreak because I need to lose a couple of stone again. But crypto certainly is not fun to have if you do pick it up. And then don't forget, and as Dr. Cat Hart said, you got to think about the mixed groups. You got to think about the spread. You got to think about where it's moving around to. So when we're doing this sort of forensic detective work, sometimes you might wonder why we're looking at other groups of calves and other animals. And actually, we're trying to work out what's happening before or after, and not just what we're seeing that's being presented as the sick calf or the sick couple of calves, because it could be the tip of the iceberg. And so we just have to be always on the wire there for that. So to kind of give you a sort of breakdown, before I go on to some farm examples, dairy beef, and there's probably a lot of people here that are rearing calves, beef calves are coming through market or direct off a farm, and they present a different problem in a way, because they're generally either being mixed as groups. So we're bringing them onto farm and quite often mixing from multiple sources. They're usually in batches, at least I hope they're in batches, because as we heard earlier, all in, all out is definitely much better than dribble in, drag out, as I would call it. And if you want to look at it as batches, they have different problems, but you can have different approaches to them as well. The disease risk comes with mixing of groups, and mixing groups in airspace, or even pen to pen, with the dribble through of mild calf diarrhea or slurry being spread from pen to pen. We can think about managing disease on arrival. For me, coccidiosis is probably the biggest issue. Crypto's kind of always gone off the end, generally, if the calves are more than 14 days old, but you still have to be aware of it. I tend to find once a calf reaches 21 days old, crypto's less of an issue, because they've got their own immunity, or they should have by then. And there's a lot of work that kind of says when a calf reaches 21 days old, you should be able to get crypto out of it if it's perfectly healthy. It's already been through that. It's only a 5-day life cycle. And then you're looking really at how do we manage that group and how do we deal with these? And my own experience would be either thinking about the likes of decoquinite into the feed, but when they're young calves, they're not taking a lot. And their body weight means they're not bringing in a lot of that. So you have to think about that. You have to think about how do we manage them. It could be you're using a timed drench, for example, and it's worthwhile talking to the vet and working through a program to manage, because every group also is different. Unless you're having from the same single source dairy farm every week or every fortnight, and you're managing them all in groups once a week, for example, your chance of having the same set of diseases week in, week out are actually quite low. Although you might think that's right. If you go to market and buy 10 calves, it might come from 10 different farms, and the following week another 10 different farms. You're mixing a disease, plus what they're carrying at that stage as well. So just a couple of quick examples, really. This is actually one just from last week that I went through, and I thought it was really good to sort of give you an example of it, really. A farm calving a lot of cows, are calving about 1,000 cows at the moment over about 9 or 10 weeks. The first sort of 100 calves are in the calf shed, and I was called to an issue where we'd had one calf die about 7 days old, but we seemed to be having a sort of bit of a mild scour. Something wasn't quite right. It was in different pens in the first calf shed. There was a bit of an appetence, which was quite strange. And actually going to visit and going through things, although we did some scar checks and we did find some issues in the background, in reality, this farm had, you know, fantastic IgG results. 8 out of 9 were excellent, and the 9th animal actually was still well above normal for the IgG. We found a mild rotavirus response on 5 calves tested from 5 different pens that had a little bit of sort of mild diarrhea, but not really anything that was too obvious. On clinical exam, there was nothing really jumping out at me. The calf that had died, unfortunately, had already gone off for the hunt, so the chance of actually opening that up was 0. I watched them feeding because it was just interesting. I was there when they were feeding, and it looked like the calf started to drink and then stopped drinking, and which is quite intriguing. And normally that could be a sign of something like crypto, where they've got sore guts and that, or it could be milk mixing issues or something else. Weirdly, the shed had nearly 100 calves in it in pens of 10, and it was multiple pens, and they were quite often all showing the same symptoms, which just didn't quite fit for rotavirus even, because one pen, the calves were only 5-6 days old. So going through it, you know, is this disease or is this something else? Yeah, there's a bit of rotavirus. You know, start to worry about salmonella. We'd had a dead calf. We had one calf with a bit of a temperature, but the others didn't have a temperature. Nothing looked really that sick. It looked more like a feeding problem. And then going through it, it turned out that on discussion that the milk powder was from last year that they were using, because they'd over-ordered milk powder, and there was 2 pallets to use up of last year's milk powder, both of which were 3 or 4 months beyond expiry date. And actually mixing up one of the bags, you could almost smell a bit of a funny tint in the air. And watching the calves going up to drink, they wanted to drink, but they started to drink and then stopped. And this is a good one for you. Something I've learned, and you sometimes see it with borehole water as well. Calves do not like any taint. They are very, very susceptible to feeling a change in temperature or taste or water taste. I've seen on one farm that we use that has borehole water, calves will go up to try and drink, and they just don't want to drink out the water bowl. And yet when we move to mains water, they're more than happy to drink out the water bowls. So it's things like that that actually can throw you a little bit. And as a vet, you know, here was an issue where, yes, we had a little bit of rotavirus positivity, but it wasn't saying this is a calf outbreak of rotavirus. This was literally a case of deep pocket, short arm farmer syndrome, as I would probably call it. And don't take it the wrong way, because I'm sure we've all been there. But that milk powder had sat in a barn, probably in the sun over the summer as well. And so, you know, what we'll probably do is we'll wait till the calves are stronger. We went and got some different milk powder, started feeding it, and everything's vanished within 2 or 3 days. And when we get through a little bit further, we'll start back feeding the old powder. So it'll probably be 2 bags of good powder, 1 bag of bad powder to get it used up, because I'm from Scotland, so I definitely have short arms as well. This is another example on a farm, a large dairy unit, this time sort of calving over 70 cows a month. When I got involved with them, they were running about 10 plus a month every day, 10 plus a month dead. And they were showing calf scars around 10 days old, sometimes watery, sometimes a little bit of blood, but in each group there could be up to 50% of the calves affected. The farmer was pulling their hair out and really quite stressed about it all. And on this sort of issue here, the mental health effect on the farmer and his staff are just as bad as what we're seeing in the calves themselves. And on this farm, we were really looking to try and get to the bottom of what was causing the problems. And it seemed to be multiple, actually, because the colostrum quality didn't look too bad. It wasn't brilliant when we checked the colostrum, but when we checked the calves themselves, we had poor levels of colostral transfer. The farmer was adamant that they were all getting tubed, so we had to go through and try and work that out. We did all sorts of different checks. We saw a background salmonella was there. It was a weird exotic salmonella from birds. And there was crypto, and there was quite a lot of crypto, and it looked like the management had changed on the farm. So this was a contagious disease. Although the cows were being managed in groups, the calving yard was overstocked. It was for 350 cows, not 700-800 cows. So it was one of those classic examples we see a lot. We went back to the very beginning and started looking at immunity and challenge. We actually introduced on this farm vaccination for the cows. They were already using a scour vaccine, but we actually introduced the crypto vaccine, Cryptium, on this farm just to try and help get on top of things. But obviously that was going to take 2 or 3 months to work through. So in the short term, we had to introduce some other control measures for the salmonella and the crypto. And in the longer term, we changed the management system. So in the short term, we had a weekly vet visit to try and oversee the calves, take samples, make sure we're on top of things. Over the space of 3 months, we went from losing about 10 out of 70 calves a month down to 13 out of 210 that had been born more than 24 hours old. So that the farmer was over the moon with that. We were still pretty disappointed, but it was a definite improvement. And the other thing we were looking to do was monitor daily live weight gains, because I think that's a good example there of seeing where things are changing. In the longer term, we were able to stop using this blanket metaphylaxis, which is very good for us, and the farmer was much happier. We're down to less than 10% of calves showing any real issues for more than 50% of the group. There is still a background salmonella on this farm, and no matter how hard we seem to work at it, we can't get rid of it. And then the daily live weight gain, you can see, was up dramatically, and the farmer now has his own beef operation to finish calves. So in the round, it's probably the best way of looking at this. And that's it, really. Thanks, Kat.
Cool. Thanks, Rob. That's really good to get those practical examples. So we have had lots and lots of questions, which is amazing. So I'm just going to put the holding slide back up, and then I got kicked off. So I'm just trying to get everything back in. Here we go.
Just to add, Kat, as well, we're going to be asking some poll questions, which are going to be linked to some of the questions. So if listeners can answer the polls, then that would be great. And,
cool, yeah. If you can do the polls while we answer the questions, then we can, hopefully that will work. Sounds complicated, but yeah, I'll get started on the questions because we've got lots and lots, and we want to get through them all. So if there's any other questions, put them in the chat. So the first question is, how early can crypto start to shed in baby calves? Which we've discussed briefly, but I'll go to Kat Hart in that one.
Hello there. Yeah, so from a crypto point of view, it is this single-celled parasite. So why it's so hard to control is it's almost like an onion with lots of different shells, so it can resist in dry weather, in damp weather. It's a really clever bug. But what it does is it goes through a life cycle, which has a sexual stage and a non-sexual stage. So it's really clever again in how it can multiply into massive numbers. But really, it takes 5 days to do a life cycle. But what we generally see is it's in that sort of second life cycle, which is when we see the disease. So generally, we see signs around that 7 to 20 days, so 1 to 3 weeks of age, as we've hit. I think all speakers spoke about that. But really, it shouldn't be younger than 5 days, just because the life cycle shouldn't have been completed by then. But that's the sort of understanding from a crypto point of view.
Yeah, exactly. So, and Rob sort of mentioned this, didn't he, when he said if they're very young, sort of under 5 days of age, it tends to be bacterial. But yes, so if you're seeing 5 days and older, very likely to be crypto or one of the viruses. So I'll move on to the next question. Best disinfectant on the market for battling crypto. I'll go to Rob first, just to see if you've got anything that you think practically you would recommend to your farmers.
Yeah, two things. The first one is that, like, there's a lot of products out there in the market. I tend to just recommend Cyclex from one of the companies. It's a sort of phenolic type one that's designed to be contact, and it has to be contact for a certain length of time, which is the other part of really what Kat was saying earlier, removing everything. So it's called cleansing and disinfection. So it's removing everything first and washing down. And something that I learned actually from the pig and poultry side of things is that once you've done that washing down, is letting it all stand to dry, because actually there's a water film left there, A, that's got some bugs in it sometimes, at B, it actually helps dilute the disinfection you then apply. So it's letting something get on there, and then letting it have time to do its proper contact after it's dried out. So I think the Cyclex, I think I've got in 4 hours.
Cool. And Kat, do you have anything to add to that?
No, just it's about this drying phase. So we want to clean it, get as much organic material off, dry it, apply your disinfectant. Some of them are more as sprays and some of them as foams, but making sure then that has a minimum. There are a lot say between 2 and 4 hours, but really if we can wait that day, then that has a drying effect after the disinfection as well. But it's to sort of, a lot of people will only move calves when they've got calves sort of queuing to come into that pen, instead of thinking, actually, no, if we've got a week to get ahead of ourselves, let's clean them out. As soon as the calves leave the pen, really we want the muck to be scooped out, the pressure washers on. And yes, when you choose to disinfect, whether that's a day after you've sprayed or a day before they come in, is less important from my point of view. For me, it's that drying time and making sure we've got that minimal contact time. And all the disinfectants I can see sort of aim for a 95% kill. So again, we're just trying to dampen down that level. We're not trying to eliminate everything. So thinking about that, really.
I think you've got a bit of background noise, Kat.
Sometimes it goes down to like 20 quid, isn't it?
Okay, well, we'll keep going. So next question. Does pneumonia open the door to scours? I was going to sort of chip in here. So yes, actually, we tend to see more the other way around, in that scours opens the door to pneumonia, because they often get scours a bit younger. So they tend to get scours, and then pneumonia comes in. But equally, if a calf has been kind of affected by one, it is more likely to be affected by the other, just because its immunity will be down. It won't have probably been eating and drinking, so it won't be up to fighting off other pathogens. It's these calves that have got scours or pneumonia in the first place probably have more likely had a problem with their colostrum management or something else. So yes, the answer is yes to that. So I'll move on to the next question. How can you control or prevent scours when buying in calves on milk? I'll go to Rob on this, because I know you've got some good experience here. Quite a broad question.
This is like the sort of Damocles moment now, isn't it? Yeah.
Let's not talk for another hour.
Yeah, as I was explaining, the every single batch is different. When you're buying in calves on milk, you kind of have to take probably the broadest brush approach, which for me would be making sure they go into a pen on their own. You don't mix them up unless you're going to buy them in one day, mix them all together at that point and start with that group going into a clean pen, let them be exposed to disease, and then work through from there and insert coccidiosis management regime and look at crypto control, everything else. There's too many different ways of saying you shouldn't be putting antibiotics into milk powder, but people still want to do things like that as well. And in reality, for me, it's about managing everything on a batch by batch basis and not just reaching for antibiotics for blanket metaphylaxis, as we now call it, because we think there's a disease problem rather than prophylaxis, which is prevent it. So, feeding regimes, how we get them onto milk, monitoring for the first couple of days, especially with the modern milk machines, where we can actually follow speed, aggression of milk feeding, speed of drinking, all those sort of things, trying to find if their calves are going off their milk a little bit quicker, because that could be showing disease. BRD, so pneumonia syndrome, all these things can happen. But the main thing for me is if we're buying calves in on milk, you're generally mixing different age groups, different backgrounds. Some calves will be reared on cows, so they have a completely different set of bugs in their system to calves that have been reared in individual pens. And so, lots of different ways of approaching it. But I would probably say the best way of doing it is put together a plan with your vet for your farm, rather than me trying to give you something over this group chat now. Yeah,
I agree. Okay, good. I'll move on to the next one. We have kind of gone into this, but if you've got anything extra to add on this one, how do hygiene and disinfection play a part in preventing calf scour?
Yeah, so I think this is all around how we clean these calf pens. So for me, it's all about just limiting that level of challenge that this new calf's going to go into. So that's why I think all in, all out is definitely the way forward, and how we can change our thoughts so that a calf enters a pen and then doesn't move out until it's, say, a week after weaning, or, minimize the amount of pen moves a calf needs to do, because that will minimize the amount of cleaning you need to do, basically, to make things a bit easier. So sometimes it does take that step back to look at your system from an overall point of view, rather than, I know when you're in that problem, you're often pedaling so hard that you're not seem to get anywhere. So sometimes stepping back, actually saying, do the calves need to be in, say, individual pens for 2 weeks and then go into a group? Do we want them to be going into a group at sort of 2 days of age, and really thinking through that? And that's sometimes where a vet can sort of be just that person to bounce ideas off, really, rather than just an information point. Sometimes it's just somebody to talk to, gets you to step back from the problem and see things wider, really.
Yeah, I mean, in my experience, I know it's not easy for everybody to do this, but the all in all out systems are much more successful at controlling scour. It's just something I've seen.
Yeah.
Yeah. So next question. Long question. Thanks, Tracy. I've experienced scour affecting indoor and outdoor born calves. Sometimes there's a reluctance to test, which I know I've certainly seen that as well. How can testing identify whether issues are primarily environmental, management related, or genetic, and guide longer term herd resilience? You did sort of mention this, Rob, didn't you, briefly? Is there anything you want to add to what you already said?
Yeah, I think this is if you're seeing issues both indoors and outdoors in different systems on the same farm, for example, as well, you used to have to start to think about, testing to look for disease. But like I explained also, common things are common. So colostrum quality, colostrum uptake would be something to really look at there. Nutrition of the cows pre-calving is a huge impact. The colostrum is actually being produced 3 to 6 weeks pre-calving, not in that last 3 weeks. By the time you try and up feeding it 3 weeks pre-calving, it's almost too late. The antibody takes time to be produced and laid in the udder. So I think we also have got to look back at far off dry cows and drying off, etc., and thinking about that differently. So that's a really tough one. Management, I'm not sure genetics wise, there's probably a little bit of an impact there, but I think the work that's been done on genomics and calf scar, it's so multifactorial that and so different between farms, that the genetic side of calf scar is pretty minimal, I believe, compared to, let's say, for example, mastitis. So there is certainly some impact you could probably look at there, but I'd also be looking at things like the size of the cow, her udder condition, and things like that. Especially if you're calving suckler cows, we tend to keep cows sometimes a little bit too long because they're very good and they breed well. But if they've got big saggy udders with great big carrot tits, for example, is the calf going to get its colostrum? So even going around topping up cows with colostrums is not a bad idea, with powdered colostrum or something like that. But there's so much more to it. Yeah, again, it's not an easy one to answer.
No, that's good. So we've got a couple of questions around cryptosporidium specifically. So there's one that's asking about strategies to prevent and control crypto. And then there's another one about the fact that they get a lot of calf deaths due to crypto. We have another webinar, which is going to be next Friday, and everyone who's registered for this webinar will get the link to sign up. So I'm not going to go into these questions because we've got so many questions. I'm not going to go into these specifically today because we will answer these questions in the next webinar. So please sign up for that. So I'll move on from those. So that's for 3 questions on crypto. I know it's a big issue. Oh, there's somebody else who said we're about to start using the crypto vaccine. What's the most important things to remember? Again, we will go into that in the next webinar. So please do come to that one. Okay, moving on. We feed on milk bars and let them drink as much as they want, which may be 4 litres each time. Is there any downside to, I guess, ad lib feeding? From my perspective, I don't think there is, because I think you can see the benefit according to growth rates. What do you think, Kat?
So ad lib feeding is great. I think there are more people starting to do it. More machines are allowing that sort of facility. It's not true ad lib, but it can go up to sort of 15 to 18 litres, which most calves will still deem as ad lib. The only challenge really is how we wean off it and how long that takes. So I think from the start up to sort of 4 or 5 weeks, an ad lib system is really good, because, as I said, particularly in that first week, there's often still an energy gap between how much a lot of farmers are prepared to give these small calves compared to how much they actually need for all this immunity to really kick in. But it is that wean down. So really, from an ad lib system, we're looking for a 5-week wean off. And that is involving steps to try and shock some of those calves into really eating some concentrates. So there's no downside. Yes, it isn't a cheap option, but we're thinking about this as an investment for the future. So I think that pays off. It's just how we wean them off, because it will take 5 weeks really to get a smooth wean down.
Cool. Yeah, thank you. So next question. when using pain medication, this also joins into another question, because I saw somebody had put in a question which said, what is an NSAID? So this is a short term for non-steroidal anti-inflammatories, so such as your Metacam. So there's a question here about that those pain, those NSAIDs, and also electrolytes. How long do you use them for? I think basically the question is trying to say, Rob, how long would you normally recommend they give electrolytes and non-steroidals for?
Okay. This is again a farm specific one, really. For me, the electrolytes, I actually am a great believer in feeding calves that have got some form of true scour 3 or 4 times at least through the day with milk, trying to break it up a little bit, but also make sure we feed the electrolytes either with the milk, because some are designed to be fed with milk, some are designed to be fed separate from milk. If you're using a whey base, it doesn't really matter so much as with a skim base from the point of view of the clotting and everything. So there's a little bit of a sort of situation of looking at it there. But for me, the electrolytes, at least 2 or 3 days of electrolytes, even after the scouring is finished, because of the fact that these calves have lost minerals, have lost electrolytes in there, as well as the fluids. And the milk, obviously, as Kat was saying, it's as much about keeping the gut health going and trying to maintain some form of sort of microbiome, the bugs that are in there, the good things that we know now are there, as well as helping the cells regenerate. So for me, yeah, I would probably go 1 day beyond the calf looking better. You can pinch their skin and tell how much they're dehydrated. You can look at their eyes and see if they're sunk. You can touch their nose and see if they're damp or not. You can feel inside their mouths, all those sort of things. But in reality, I would say 1 day beyond the sort of clinical signs of scouring would be my minimal. And then with the anti-inflammatories, so the likes of meloxicam will be every couple of days. I wouldn't want to go overboard with that generally, because of the fact that, again, we touched upon it with the kidneys and that side of it as well. So I would tend to say one shot's enough. If with that, just to help them on the first day. If you think they're actually worse after that or something else going on, then that's when we really ought to have a conversation between the vet, and if the vet's out weekly or whatever, taking a poo sample before you go and treat with anything, if you do decide you're going to treat with something, is not a bad idea either, if you're starting to see problems break out. So
no, perfect. Next question, is the graph of the ages at which certain types of scour occur from pretty recent data? Yes, that graph comes from the APHA, and that was in the last 2 to 4 years, so that's recent. Next question, rattling on through. Once the calf overcomes the scour, will the intestinal villi return to a healthy normal length? Yeah, no, that's an interesting question. It may not. So there are some different work around this. Hopefully everyone remembers the slide I showed with the long villi and the stunted villi. It does depend on the severity of the scour and the pathogen that causes it. In some animals where they have a milder scour and they're treated quickly, then the villi can recover. If they have a severe ongoing problem, then the villi may not recover. So yes, that does depend. I'll move on to the next one. This is again a crypto question, which we will come back to in the crypto session. So that's to do with crypto and using the crypto vaccine with Halacure. We'll have to skip over that one, I'm afraid. Another one about Halacure. I will quickly answer this one. I've been using Halacure for years. If I vaccinate, do I still need to use Halacure? Actually, we'll go into that one in the crypto session, because that's again a slightly complicated question. So please come along to that one. We have so many questions. I mean, I'm really happy to see. Somebody said, assuming antibiotics don't treat parasitic causes, not generally, no. So if the cause is parasitic, antibiotics won't treat that. And as Rob mentioned about the sulfonamides, there is one that may, but that's something you need to speak to your vet about, really. The next question, in your experience, which issues on farm do you see time and time again that make scour occurrence more likely or that are hardest to change? That's quite a big question. Kat, have you got any kind of short answers to the long question?
No, it is, a challenge. I know, like, time is wrapping up. As I said, like, it's amazing how many questions we have had, really. So yeah, it is a tricky one,
it tends to be, it is the crypto that's the biggest issue, isn't it, really? What is your view? Oh, this is an interesting one. What is your view on the use of pre and probiotics as a tool for scour management or prevention? Do you want to come in on that one, Kat?
Yeah, there are a lot more coming to market, and they have got some really interesting studies behind it. I think it does seem to vary a bit farm to farm. Some farms seem to love it, particularly with the crypto, and if you are using the halofuginone there, it can act as a bit of a booster because that can be quite toxic to that gut biome. So some farms, particularly in that challenge area, have seen an improvement. I think, again, I love colostrum, and that has it all in there. So it's more how we can use that product, whether we can extend its use, and then it's sort of a free product on farm, really, rather than buying anything in. The liquid ones do seem to have a bit more science behind it to the powdered ones, but I think it is an area which for the future is going to be a massive area of growth.
Definitely, agreed.
I was just going to add one thing, Kat, there, that one of the areas that I'm really keen to see us use more of is pasteurization for colostrum, and then feeding pasteurized second and third milk beyond it as well, because pasteurizing has been shown to actually improve colostrum uptake, not reduce it, which has been some of the interesting work that people would say it reduces colostrum availability, actually improves it. And actually pasteurizing that second and third milk, we've got a lot of farms now using that as transition milk now to day 5 or day 6. And that's making a huge difference, I think, to the health of the calf's gut. Not necessarily, obviously, they don't absorb very much more after that first 12, 24 hours, but there's definitely some work there. And on our larger farms, especially now, it's becoming more and more of a key part of our management strategy. So, yeah.
Yeah, I think we're all here quite agreement about pasteurization and the fact that we are probably going to be utilising it more and more. And particularly with some of the grants that are available, it's something that farmers should be thinking about. Somebody's asked about salmonella, which we're not going to go into in too much detail here at all. Salmonella is a tricky one. There's no on-farm test for salmonella or clostridia. It needs to be tested in the lab, and there is a vaccine for salmonella, but it's more farm specific. So we won't. I think this is something that you'll probably need to speak to your vet about. So I'll move on with the next one. UV protocol. Does anyone have any comments on UV protocol? I don't know anything about this.
So I'm guessing this is hinting at the unpredictability of the UK weather and how we can use sort of sun UV from our drying and disinfectant point of view. So yeah, this summer's been great from a housing point of view, because our washing dams are drying really quickly and desiccating out well. But it is unreliable. So, for example, if you've got more of the pod or hutch systems on farm, then moving those can be a great way of using that UV. Obviously, within a shed space, the UV is more of a challenge, but the drying is still really important. So, yeah, if you've got those sort of lift up and move options, then do that. But if you don't, still it is that drying time. And if you're going to choose a once a year deep clean, then generally this summer, we have higher UV then, so make the most of it.
Yeah, exactly.
Kat, I think we've probably got room for one more question.
Yeah, we're really coming to the end now, aren't we? It's just so many good questions. I'm gonna. So somebody said, I'm just mentioning this now. I'm going to the last question. Vaccines were mentioned briefly, but is there merit in wide calf vaccination? So basically, for scours, you can't really vaccinate the calves. You have to vaccinate the cows because you need them to get the benefit of the vaccine through the colostrum. And we will talk about that in the next farmer meeting. So hold that thought. In terms of, you can vaccinate calves for pneumonia, but that's probably one for a different session. So I'm just having a look at the final few questions just to see if there's anything that really sticks out to me. Yeah, there's somebody who's asked about whether you can sterilize drinking water. Do we have any knowledge about this?
Yeah, we've got one farm uses an ozone treatment for their water, for the water that's going into the drinkers and through the milk machines. It's looking quite interesting, and I think there's some work at one of the universities that's been going through now, and I believe I actually read about somewhere the other day that somebody's commercializing it. Again, Kat hit really upon it, which is our water bowls and water troughs, it's amazing how often everything else gets cleaned and disinfected, and then you go to look at this fantastic bacterial soup. And especially when you look at something like mycoplasma or crypto, those things, they just both love poor water bowl cleanliness. So anything like that's probably a good idea. I think if I was going to spend money, I'd probably look at pasteurization before I went and spent money on treating my water supply, unless you're using water that's coming off of a roof or drainage into a lake, where I've actually seen these weird salmonellas appear from sometimes. But we shouldn't be using those for baby calves. Never should be using. It should always be mains water for baby calves.
Yeah, and always from the day of birth. Right, I better hand back to Sarah, because I think I'd love to do more, but we've done as many as we can. So thank you everybody who submitted questions.
And if we can, we will try and come back to those questions in some way or form, answering them. If we've got the contact details for the listeners, then we can come back to you with those questions. But thank you so much to all our speakers for today. I think it's been really insightful to hear what you've got to say, and hopefully our listeners have enjoyed it. And I think from the amount of questions that have been asked, obviously it's a topic that there's a lot going on, and a lot more information to find out about scours on farm. And as Kat mentioned, we have got another webinar coming up a week on Friday, so you'll get a link to that because you've registered for this one. So please come along to that. That's specifically on cryptosporidiosis, and we'll be talking about management and vaccination there. So a recording of this webinar will also be sent to you, so you can look it back, share it with fellow colleagues and farmers, and that's on that there. So I'd just like to say a massive thank you to all our speakers, and for you joining us today, and enjoy the rest of your day. So thank you ever so much, everyone.